Hi everybody, Sally here from Switch on Health. Here is the next remedy in our series. This one is Belladonna, one of the major children's remedies alongside chamomilla and pulsatilla. And this is a great remedy, and we'll talk about that as we go. It's also part of the deadly nightshade family, the Solanaceae family, which means that in that family also are things like potatoes and tomatoes and capsicums. And they do say that someone with autoimmune disease shouldn't eat nightshades because it's part of the autoimmune diet protocol. But let's move on to belladonna because this isn't nutrition, this is homeopathy. So here's a lovely photo of what the berries look like. It was mainly the berries that they used initially. It is a poison. It's one of the first of our series of poisons. Again, along with arnica or arsenicum, okay, or even hyoscyamus, henbane. And these are the flowers. So it has been used in the past as a beauty product of all things, this poison. Women would ingest this would ingest these berries. I laugh because I find it quite funny. Would ingest these berries to dilate their pupils and flush their cheeks because it made them look more attractive. And this was during the Victorian era. The berries were used as eye drops, but unfortunately, it is a poison after all. Some women died from too much, and it also could have caused blindness in many women. It was given during a scarlatina, which is also known as the scarlet fever, way back in the 17th century by Hahnemann, and he would give it as a prophylactic, so as a preventative, twice a day to children in particular. It is poisonous, as I said. It's one of our poison remedies. And it is only ingestible by goats and rabbits. So if you're a goat and a rabbit, you can eat belladonna to your heart's content. It grows in limestone. Now here is a collation of where it is grown, can help with an alternative remedy to compare, and that is kelp carb. So belladonna is the acute to kelp carb, as ignatia is the acute to natmur for grief. Okay, so it is always a remedy that you would consider comparing belladonna to kelp carb, especially if you're looking at a constitutional or chronic situation, as opposed to acute. So it is, from an acute perspective, it is often sudden. So you can see there that that's highlighted. So that's keynote, and violent. So we'll talk a bit about that violence later on. Gets rapidly worse and then can suddenly stop. Mainly given to children, as I said, and compare with chamomilla and pulsatilla. The affinities in this case, nerves, blood, skin, and glands in particular. And glands, especially when there's fever involved. So this is Queen Elizabeth, and you cannot see the colour of her eyes because her pupils are that dilated, and she has quite flushed little red cheeks. Now, strange, rare, and peculiar. You're looking at this going, oh my goodness, what does all this mean? Okay, so these are some of the strange, rare, and peculiar rubrics or symptoms that only have, and this is the importance of strange, rare, and peculiar, or PQRS. The importance of finding a PQRS is that it's going to have less remedies. So if you just go anxiety, there's going to be hundreds of remedies. If you go anxiety at 3 a.m. in the morning, where they are frantic and desiring peanuts, then that's a more PQRS. So in this case for belladonna, the PQRSs are desires, lemons and lemonades. Now, when I looked this up in the repertory, there was only 14 remedies involved, and only 2 of them, belladonna and sepia, were part of Bowenhausen's grading of 1, 2, 3, 4, where it was bold and capitals. So it meant that most of the provers proved this symptom. You can see there with lemonade, there's 18 remedies. And again, belladonna and sepia are the main 2, bold, capital grading according to Bowenhausen. Mind, bite, desires. So they want to bite. Now, there's children wanting to bite. There's only one remedy, belladonna. Now, that's a great one. So if your children start biting you, but this is when they are unwell. This is not when they are well. Mind, bite, desires. That's how it's written in the repertory. So it's basically during a delirium, they desire to bite. Okay. During, they want to bite everything. All right. The delirium one, you can see there, only 10 remedies. Again, belladonna and stramonium were the only 2 that had that particular rubric or symptom. There was only 1 for desires to bite at everything. Again, belladonna. So you're getting the idea here. Mind desires objects. In this case, it was hyoscyamus, part of the same family, and stramonium. Mind desires to bite people. Again, only 2 remedies, belladonna, stramonium. You can see here there's another, you can work it out for yourself what all of these mean, but here are some of the other strange, rare and peculiars. Mind, shining object aggravates. Mind, delirium with dilated pupils. Mind desires for exercise, so they want to exercise when they are unwell. And this is a known term or statement that's made about belladonna. They are an angel when well and a devil when sick. So when they're well, they're entertaining, they're bubbly, they're jovial, they're lovely. When they are unwell, they are violent. And we will discuss what that means in a minute. So, from the mental and emotional standpoint, they look feverish, they are dull, or they might be in a stupor. So they might, you might find that they have this reduced consciousness, that they are slow to react, that they are sleepy, they look sleepy. And this is generally during times of illness, during times of exhaustion, and during times of intoxication. So, excuse me, you could give belladonna when somebody was very intoxicated, potentially, depending on their behaviours though as well, and depending on their differential diagnostics. But you can give remedies when people are drunk or under the influence of drugs. They have this delirium, so they are quite dazed mentally. So they could even jibber jabber. So they could be going and talk in tongues and be moaning. So they are quite delirious when they are unwell. When they're unwell for a longer period of time, so say, more than a week, 2 weeks, they may have a tendency to hallucinate. Especially when they close their eyes. So they're going to see beasties, they're going to see monsters, they're going to see things that are not there. Now, here's this violent aspect of them. Devil when unwell. Angel when well, devil when unwell. Especially seen in children, they become very violent. They become furious. Again, key word. Destructive. They will kick, they will bite, they can scratch, they can scream, they will screech, they can tear at you, they break things around you. So you can see they're violent. Whenever you think violence whilst ill, think belladonna. Okay? Especially if they're kicking, biting, scratching, screaming, tearing at things, you know. The other side to belladonna when unwell is that they want to escape. Now, another one of those remedies that wants to escape is carcinosum. So, again, you need to differentially diagnose. And another differential diagnostics here with pulsatilla, light-haired, light complexion, blue eyes. Pulsatilla, blonde, blue eyes. The belladonna patient will have very acute senses and will be very, very sensitive. So they will be sensitive to any changes in temperature. They're generally a chilly remedy, but they're worse for temperature changes, so such as warm to cold and cold to warm. Again, a bit like Bellus perennis or mercurius, temperature plays with this particular remedy as well. So again, differentially diagnosed. Sensitive to any sort of draft or anything that's damp. They don't like their head to be uncovered. While they're in this sensitive state, in particular when they're in this sensitive state, they don't like their head uncovered. So you might find that they will want to wear a hat inside. They don't like their hair washed. They don't like their hair to be cut. You could give this to the little ones, when they're first getting their haircuts and they're a little bit anxious about it and they might get a bit funny. You could give belladonna. Yeah, if they don't like having their hair cut, you could consider belladonna. And I've seen and heard of children that, do not like that aspect of having their hair cut. And that's that sensitivity, the sensitivity to noise, the sensitivity of having their hair brushed and washed and hot and cold and all those sorts of things. There is a sensation, though, in their brain of a swooshing noise or a swashing noise. So it's like, all right, so there's that sort of noise in their brain they may feel. When we then move on to some of the generals, their pain severe. Their pain is throbbing to the point where you can actually see their carotid arteries throbbing, going boom, 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 boom. You'll see it. And especially when they're in this sort of violent, angered state. There's swelling, burning, pulsating. They will describe their pain as sharp, cutting, shooting, hammering, throbbing. Right? There's also, though, a heavy feeling about them, heaviness of their head, their eyes, their hands, their feet. The females may actually say that their uterus feels quite heavy. And this is very important, sort of, during menstrual cycles and the like. But you would also need to potentially compare that heavy feeling or that droopy feeling in the eyes is Gelsemium as well. Sensation is if there's a band around their head or their chest, there's a ball in their throat, their bladder or their abdomen. So bands and balls are important here. They often feel a twitching, jerking, spasms. They'll describe it as a twitch or even a shock like a lightning bolt type constrictions. They potentially feel that mostly in their vaginal region or the throat. They have a hot head, but they have cold limbs. So that's important because there's others out there, other remedies out there. Sulfur in particular has hot feet. Phosphorus gets hot hands. So knowing different varying degrees of temperature of their body is important to ascertain and ask questions about. So hot head, cold limbs, their feet are icy cold, as opposed to, again, sulfur, hot feet. They have to have their feet out of the bed. They are generally thirstless and they have an aversion to water. Again, another one that is thirstless is pulsatilla, another one of your children's remedies. And that aversion to water is also a sulfur thing. So again, compare your remedies. When feverish, though, so when they're feverish, so when belladonna has a fever, they are no longer thirstless. They become thirsty and they then desire cold water. So that's a good predominant sort of thing to ascertain, especially when they have a fever. They then become thirsty and they desire cold water. So generally, they're a thirstless person, but when feverish, as you can see, thirsty, wanting cold water. It is also predominantly a right-sided remedy. More generals. Now, there's a lot of generals here because it's a very big remedy. It's used a lot. I have not used it a lot because I don't have a lot of children that I prescribe for. But those that prescribe for children, you will find that you will use this a lot with your chamomilla and your pulsatilla. And so it's good to know in detail about belladonna. You've got here that there is a worse for sudden jarring. Now, jarring's a big thing for belladonna. Even something as slight as another person touching the bed. They do not like someone. They can sometimes not even handle having the sheets over them, and that's a very big one for people when they are quite unwell. That not even the sheet can be too much for them, or someone sitting on a bed can be too much for them. Therefore, they're worse for touch, they're worse for pressure. Here's this sensitivity thing again. Bright lights, noise, drafts. They have a checked sweat, so their sweat can even be quite cool to touch. And they are worse for only on the covered parts in the head is where they tend to sweat. So when they're wrapped up, they'll sweat their whole body. But if they are uncovered, it is generally just their head and anything that may be covered. So if they've got a jumper on or, tracksuit pants on or whatever while they're unwell. They have an aversion to meat and milk. But here we have, again, that strange, rare and peculiar. They desire lemon and lemonade. They are better for gradual pressure. Now, see, before they were worse for pressure. Now, that's that hard pressure. But if you are slowly, gradual pressure, when you're slightly patting, slight pressure, they are better for it. They're better for lying down. They're better for lying on their abdomen. So knowing positions of when they're lying down is important too. Are they, what side are they better on? What side are they worse on? How do they prefer to lie down when they're lying down? Sleep positions are another one as well that's important. They are better for bending backwards. So this is like this. They will bend backwards. As opposed to magnesium phosphate, which are better for leaning forward. Okay. And again, light coverings. So, no heavy blankets, no doona. Lucky to have a sheet, if that. Their tongue will be red strawberry, red around the edges. And you will often find that the children may, because of a fever, especially if there's glands involved, and you give this when the fever has glands involved, is panting. So they're going to go a bit like, a dog trying to cool itself down. You might find that the patient does that as well. Times most affected, afternoon, 3 p.m., 11 p.m., especially after midnight, and they're worse at night. Dreams. Now, their dreams are fretful. They really are quite scary. There's nightmares. This is why they can become quite violent. Again, that's that hallucination aspect. They're wild. They're frightening. They're watching people quarrel, or they're witnessing a fire, or someone's trying to kill them, or they're being robbed, or so they're nightmares. Some of the physical symptoms. most important is that flushed red face. But again, compare with sulphur because it also has red face. All right. Flushed red face. Their appearance is important. So if they're coming into you and they're looking flushed, you can start thinking of remedies. I know we shouldn't do that, but until we've taken the case and done the repertory. But there are some keynotes, especially if this is acute, because you only have a short period of time to come up with a potential remedy. So flushed, hot red face, skin bright red to the point where it's glossy, and I'm sure we've all seen where a wound has been that tight and that swollen on the skin that it becomes shiny or glossy and then moves to this sort of dusky coloured red, so that it moves to a more less shiny sort of how can I explain it, darker red, even a bluish red as it says there. And that because and again, sometimes that bluish red you might see in those lips where there's cyanosis sort of potentially happening, which means that they're struggling to get oxygen. Their eyes glassy, glaring, dilated, parasympathetic nervous system, they're going to have pin-prick pupils. Sympathetic nervous system, they're going to have dilated pupils. Eyes, glassy, glaring. Pupils are dilated. Sure, it looks pretty. Don't know about that. I do recall seeing my father in hospital one time where he was, when he was with dementia, and his pupils were that dilated that you could not see the colour of his eyes. And that is that sympathetic nervous system aspect, fight, flight, freeze. Their throat, hoarse voice, loss of voice, or a high piping voice. Now, this is important because this is when they're talking. You might find that they go and say things like, and this is why this is here, the S, the F, and the T. They might go, see, or they might go, free, or they might go, that bit sounds higher pitched than and a bit like a pipe than what their normal voice would be. High fever when glands are involved. So this is, again, when there's glandular, be it mumps or glandular fever or, any sort of gland innervation, and there's fever, belladonna is one of the remedies to consider, especially if it's a radiating sort of fever where it's, just pulsing. What happens with this one, and here's one way to tell from the perspective of a practitioner, what happens with this one is you will go to put your hand on their head to see if they have a fever. I'm sure all mothers have done this in the group. To see if they have a fever, you'll take your hand away and your fingers in your hand will still, when you do that, my hand immediately went back to normal. I didn't have a fever, but when there is a fever, you'll take your hand away and your hand will still feel hot. And it may twitch after touching, it may tingle or twitch after touching the patient, which is a significant symptom for belladonna. There's generally no pus with belladonna, so, even if it's tonsillitis or laryngitis or, glandular fever or mumps, there's generally no pus innervation. There's no pus involved. They tend to feel quite dry instead. And again, here's another one to compare with another of the dry remedies, which is bryonia. The discharge here is thin, hot, scanty, and clear. Now, it's not acrid, so it's not going to, if they're having discharge from the nose, then it's not going to crust the nose. It's thin and it's hot, but it's not going to burn or cause redness or crusties. And again, when I think, I just went back there, sorry. When I think clear discharge, I tend to think first stage inflammation. All right. More physical symptoms for this one. Like I said, belladonna is quite a big remedy. The head is hot and the extremities are icy cold. which we talked about. They are startled and jerk during their sleep. So when they are asleep, they will, they will wake or they will jerk. And they cry out while they're asleep as if they have been, well, it's during these nightmares, they'll cry out as if shocked, or they will have a restless sleep. There is generally urinary incontinence for these people when they're unwell, especially during the day. The menses or their menstrual cycle, bright red early, often comes early, and it is heavy, so profuse. And it may have a bad smell to it. Their abdominal pain, it feels as though a hand is in there squeezing their abdomen. So it's a really quite a nasty pain that they're experiencing, and hence the reason why they become quite nasty themselves. And their stools may look like clumps of chalk. So for indications, so here we have what you would give it for. Otitis media, so a middle ear infection. Tonsillitis, sore throat. Conjunctivitis. Again, with the conjunctivitis, it's going to be pink, the discharge is going to be clear, there's going to be no pus, right? It is a good one for when they are very unwell. They might have double vision, so diplopia. So they might have this double vision when they're hallucinating, when they're really unwell. That's another thing that you can give belladonna for. Glandular fever, so this is where the neck glands are involved. All right. It's good for epistaxis. So this is nosebleeds. So again, here's this bright red blood, bright red face, bright red. In this case, the epistaxis would be acute. It's not a history of epistaxis. And they will feel as though the tip of their nose is tingling. So there's that tingle again. It's indicative for belladonna. Bruxism, so that's that chin as a tooth, especially at night. A lot of the children's diseases you can look at belladonna for: chicken pox, mumps, rubella, measles, again, differentially diagnosed. It's a good one for headaches. It can be given for meningitis, but remember, please, with anything that you suspect as meningitis or any of those, because we do not diagnose, meningitis can be fatal. So therefore, we need to send them to the doctor or the emergency department. We cannot handle meningitis alone. Central nervous system can be used for epileptic attacks, acute attacks. You can give belladonna post the attack or the episode. And it is a good one for neuralgic pain, so nerve type pains. And it can be given for gout. All right. So here is a case, and this particular case, not seen as often these days because a lot of children are now wormed these days. But for those that aren't wormed, that develop worms, and you can often tell when a little person has worms because they'll stick their finger up their nose, or they'll scratch their ear, or they might scratch their bottom. So this is for those children that may develop a fever while they have their worms. So this is a case done by Lutz many years ago, but it's called worm fever, which is Helminthopiera. Now, helminth means worms, pyra, fever. Fever produced during a parasite infestation. So this is when the worms are overwhelming the body. They initially were given China, which is one of the worm remedies, but then it was followed up with belladonna given as a CM. So that's a very high potency, very, very high potency. And the outcome for that was that they were permanently cured, which is fantastic. Signs and symptoms of this: they were startled during their sleep. So this is during this worm infestation in this particular case. And as I said, these days most children, most families will worm their children, but worms still do occur, especially in those situations where they are not wormed. So they are startled in their sleep. They can awake screaming. They become enraged when spoken to. They will wet the bed. These were the signs and symptoms for this case. And when they wet the bed, there was also worms that were coming from their body anally. Their cheeks, the tips of their ears were bright, shiny, and scarlet coloured. So there's that bright red. And their mouth was quite white around the mouth. Their eyes, staring, dilated, brilliant, shiny eyes, dilated pupils. Skin dry, hot like fire to touch, and abdominal pain. So you can look at this for worms when, it's not a prophylactic for worms, but it is a curative. When we look at some of the remedy relationships here, or the remedy comparisons, there we have again calp-carb, the chronic to belladonna's acute. Both usually have that sweaty head. So it's only the head that tends to sweat. And, that you wake up and their pillow is wet. Okay. Often used after belladonna, calp-carb is. Compare with mag-phos, because that's that cramping, better for bending forward. Rumex and phosphorus has that tickly, dry cough, short cough. Chamomilla, red to pale. Not as red and shiny as belladonna, though, but red to pale. Belladonna and chamomilla can be given for dentition, but so too could mag-phos, depending on the signs and symptoms. So you do need to compare the signs and symptoms that you're seeing when Bubba's going through dentition or teething. It can be given for kidney stone pain, but it's not the primary one for kidney stones. Cantharis and berberis are the main ones for kidney stones. Bryonia, again, dry constipation in this case. Remember back where I talked about the stools would be white chalky stools or chalky type consistency. That generally means that they're dry. Sepia, because of that indifference. Belladonna can have some indifference. And for the menstrual issues, so the drawing down feeling in the womb, that sensation as if everything could come out, there's that prolapse type aspect. Creosotum and equisetum, bedwetting. So compare. You can see all these. I'm giving you these because these are other remedies to compare for acute sort of situations. Stramonium, there's that angered, frenzied, and we saw that back in the rubrics where there was those mind delusional aspects. And Hyoscyamus, also known as henbane, from the same family, the delirium, but they're more fidgety, whereas belladonna is quite violent. Hyoscyamus is going to be more fidgety. They're going to be restless, and they don't have as severe a fever as what belladonna does, but they are quite agitated at the same time. But certainly not as violent. They won't kick and scream and bite and carry on. Now here is from another homeopath. All 30C potency. It is a complex that can be given as what is called the homeopathic Panadol, and it includes aconite, belladonna, and chamomilla. You can see here again, dilated pupils, rosy red cheeks. Here is another one that gives you some overall congestion, redness, heat, burning, dryness, pain. Sensitivity. Again, sensitivity is big. Delusions, excessive sensitivity. They don't like liquids. They have quite a vivid imagination, angry, rageful, inclination to suicide, not so much in children. You could look at that from a chronic perspective, though. A mania, maniacal delirium. So you could look at it for some of the mental health type situations if you were looking at it chronically. But we'll do that again when we do more chronic sort of prescribing. And then you can see abscesses, boils, epistaxis, fever, tonsillitis, worse at night, worse from the summer sun, better for rest, and the different types of potencies. That is Belladonna. Hope you enjoyed it. Learn more from Switch on Health. See you next time. I'm Sally. Bye for now.